Good afternoon, everybody. Thank you so much for joining us today for this very special presentation on the makers in our very unique binational community who have stepped up to respond to PPE needs in El Paso and Juarez. I hope that everybody is logging in today and is in a healthy and safe space. Just a couple of housekeeping items. We will be taking questions at the end of the webinar. At the end of the presentations, you should have an option in your dashboard to ask questions to any of the panelists that you're going to hear from today. We will go ahead and kick this off now. And I'd like to invite Nancy Lowry, who is the director of the MCA Innovation Center, to go ahead and tell us a little bit about what the Innovation Center does, and then introduce our first guest speaker today. Nancy?
Yes, can you all hear me?
Yes.
Okay, Jackie, would you advance the slide? So the Innovation Center is part of the Medical Center of the Americas, and what we work to do is to promote and support the innovation ecosystem in our region, to provide direct support to entrepreneurs and innovators as they try to start and grow their startups, and to support the community generally through education, special events like this Tech Tuesday webinar we're hosting right now. And in that role since COVID-19, we have supported coordination of some makers to distribute PPE to physicians both in El Paso and Ciudad Juarez. So I would like to take this opportunity to introduce Kathy Chen. Kathy Chen is the co-founder and executive director of the Fab Lab. And the Fab Lab is one of our truly unique spaces in the community that supports makers both in in the technical and in the artistic space. And I use the word space both as a place and now virtually. And they have been at the forefront of coordinating much of what's going on in the maker community in the El Paso region. And so I am going to, you have, Jackie, if you want to move it to the next slide, you have Kathy's highlights of her biography. They're on the slide, but I'll tell you that the Fab Lab and Kathy are doing an amazing job in our community working with makers. And I'll turn it over to you, Kathy.
Thank you so much, Nancy. Thank you, Nancy and Jackie, and to MCA for inviting Fab Lab to share some of our efforts and initiatives over the past almost 3 months now of quarantine. So for those of you who are not familiar with Fab Lab, we are a 501c3 nonprofit makerspace. And the word makerspace is a very all-encompassing terminology. Or at least that's how we interpret it and understand it. For us, in part, we focus on STEM education and creative STEM initiatives in our region, such as our mobile Fab Lab that we were very pleased to have launched last year. We also provide a lot of K-12 STEM support for teachers, especially for GT teachers and students, to essentially promote 21st century workforce skills and training from a very early age onward. We really see that there is a lack in our community in terms of resources that are appropriate for our 21st century economy. So we are working really hard to change that narrative for our border region. Another aspect of what we do on a day-to-day basis here at Fab Lab is we provide accessible and democratized digital fabrication service to the community. And what that means is we offer services such as 3D design, modeling, 3D printing, laser cutting, CNC machining, scanning, etc. And what this set of tools and services enable is that it enables local inventors and creators to have 21st century tools in their hands without having to stock up in their own garage the repertoire of tools and equipment, which is often very costly. They can come to us, and it's more or less, as other maker spaces are, a tools sharing sort of space. So if we can advance to the next slide, I'll talk a little bit about how things have changed for us since March. So since March, when everyone received their shelter at home order in El Paso, the pandemic had already been raging for at least a couple of months in the United States, and of course at least 4 months or so in other parts of the world. So in some sense, we were a little bit behind the curve in terms of responding to the pandemic. But we already saw a lot of supply shortages happening on the coasts. I am a native New Yorker. My parents still reside in New York, and so I know firsthand through the accounts of my family and my friends just how dire the situations were in those coastal cities and regions. So we were fortunate in our region to have been a little bit insulated from being hit so hard in the beginning of the pandemic when it reached the US. But there was a global call to action, both from global organizations such as Fab Foundation, which we are part of. They're based out of MIT, and they are the central hub for more than 1,500 Fab Labs worldwide. And there was definitely a call to action from them for the maker community and the digital fabrication community to step up to the plate. Within the Fab community, within the Fab Lab network, we often talk about global supply chains because it is an inevitable reality of our economy, of our global economy, that it is heavily reliant on cheap producers halfway across the globe to produce our daily goods and products. So when something like COVID hits and that supply chain is disrupted, oftentimes at a local level, we're really thrown for a loop and we don't have access to basic necessities. So a part of the mission of Fab Labs and Fab Networks is we want to strengthen and empower local manufacturers, inventors, fabricators to, to put the power back into the hands of community members and local manufacturing, and to create a circular local economy that can be sustained in these moments of crisis when the global supply chain collapses. So we were very fortunate to have been able to tap into wonderful resources from both the Fab Foundation and also from NIH. NIH have a website where they have been doing a 3D print exchange for about a year now. It started out being a site where people can exchange 3D models that they've created relating to various, models of viruses or biological models, and they're really for didactic purposes. But with the COVID pandemic kind of taking hold in people's priorities, the 3D print exchange, and we can go on to the next slide, as you'll see, started being flooded with prototypes and models of PPE, or protective personal equipment. This also included a lot of 3D innovations and solutions for common problems that faced healthcare workers and emergency responders. For instance, there were, just little assistive products that helped. There were ear savers for surgeons whose ears were getting chafed from wearing surgical masks for long periods of time. And it's not necessarily it's a little piece of plastic that just relieves the tension on someone's ear, and it sounds very humble, like a very humble product, but it really goes a long way to have an impact in the lives of people who are using them. So there were two supply shortage areas that were being addressed primarily. And the first is there was a shortage of N95 masks. And there was also a shortage of face shields and other types of protective wear to protect or deflect splash or droplets, because that's how the virus is transmitted. So as you can see from this slide, there were just, you know, hundreds upon hundreds of submissions from individual makers, from organizations, and it was really tapping into a hive mind, which is also what, you know, maker spaces and Fab Labs are really great at, is it engages so many individuals that it isn't just, you know, trickle down innovation coming from one big conglomerate or one big R&D department. It's really just, you know, people at home, average folks who have the interest in trying to learn more about, you know, digital fabrication and rapid prototyping tools like 3D printing. So with this collective pool of 3D models, the NIH started doing clinical tests on them to see if they would stand up to the guidelines for clinical use and the optimization for community use. So we even, you know, submitted a couple of our designs for the NIH website, and we can go on to the next slide. When the quarantine and the shelter-in-place order took place, my staff and I divided up our 3D printers, and we ended up taking these printers home with us. And we did a ton of research on the different prototypes and models for respirators and face shields that were already available. And we just started, you know, doing our own research, doing our own tests, making sure that the products that we were making address the unique needs of our community. And so, as you can see in this slide, it went from, you know, a digital file, a 3D model, to a 3D print that's in progress, to finally a finished prototype. And that was for a respirator that you would wear, you know, around your face. So if we go on to the next slide, we were really lucky at the beginning of March because of the name that Fab Lab has built for itself in the community as an organization that really prides ourselves on innovation and on the promotion and use of digital fabrication tools. We were approached by a lot of other individuals and creators in our community, and even manufacturers and engineers. So we were incredibly blessed to have been connected with a gentleman by the name of Russ Baldinger. He is the owner and operator of a local HEPA filter or a company that had a plant across the border in Juarez. And he converted one of his production lines to manufacture N100 filter material. And he connected with us, and he very generously donated free of charge, you know, rolls upon rolls, yards upon yards of this N100 material, which you can see is the material that you know, our staff member is using on the respirator itself. So the respirator, you know, it can't do anything if it does not have a filter. And it won't do anything if it doesn't have a proper seal around your face. And of course, these respirators are often needed, and there is a shortage of them in high risk environments such as clinics, hospitals. So there was, you know, a real need for us to address these shortages. So just fast forwarding a little bit, with the generous support of United Way, and with a small stipend from Paso del Norte Health Foundation, a donation from the American Engineering, Council of American Engineering Companies, and also with just, you know, small donations coming in from the community, we were able to invest in a print farm. So we purchased 10 3D printers, and we set them up in our workshop so that we could produce PPE on a much larger scale than we were able to do before. And that's one thing that's, you know, really important to note, is that 3D printers are not necessarily machines that were designed for mass manufacture. You know, you have other types of manufacturing methods that are much that are suited for large quantities of production, such as, you know, vacuum forming or you know, other types of kind of production line style equipment. 3D printers are really useful for rapid prototyping. So it's taking something from ideation to an actual physical product. And 3D printing is really slow. It is definitely not like how, you know, they portray it in Star Trek. We haven't reached that level yet where you just press a button and you know, a thing materializes in front of you. For us, just to give you an example, we can go on to the next slide. The mask that we print is just a simplified frame structure. And this was a design that we saw was approved for community use as a stopgap measure on the NIH 3D print exchange. And you can see that the mask frame is very simple. And we intentionally designed it to be that way because we needed to print it fast. And even something that is that thin and that simple still takes around 15 minutes to print to the quality and specification that we need in order for it to be used by the community. So we ended up using this Rio Bravo face frame, and using the N100 material, which you see depicted, we created a stopgap measure for, you know, people who weren't able to readily access KN95 masks. But, you know, I mean, this is definitely by no means something that you can use to replace N95 masks, but it is the closest that you can get to an N95 mask if there is, you know, no supply to be found. And on the next slide, you'll see this was the design that we finally settled upon for face shields. And this design also went through several iterations. We actually offered 2 versions of this face shield. This is the Verkistan face shield. These are all open source designs. And what that means for people who are not familiar is that these designs are able to be downloaded free of charge. You can edit them, you can remix them, and they can be used, you know, royalty free. And this is one of the most wonderful things to come from the maker community, is this real sense of sharing your inventions and your work, and you know, not always monetizing it, not always prioritizing, you know, the profit margin over the distribution and the democratization of these models. So the face shield that is shown here is a CNC machined face shield frame with a die-cut mylar shield. So originally, when we were prototyping the face shields, we were also printing them from PETG on our printers. The issue with PETG is that it only stands up to a couple of disinfections before the material starts to disintegrate. And also with 3D printing, you know, you get a lot of lines, a lot of crevices. It's not, you know, I mean, we try to print it to the best of our capability as a solid piece of plastic, but it's like, you know, a very fancy robotic glue gun. So you're still going to have some gaps, some potential areas where it's not totally smooth and totally solid. With CNC machining, it routes out from a large piece of plastic material, in this case HDPE, and it's essentially, you know, goes in and it cuts out that exact shape. So it's a perfectly solid piece of plastic. It is great for disinfecting, and it can be used for you know, clinical purposes, which is something that was very important for us. So this is something that we're still offering. We also offer the 3D printed version, but as a disposable model. So we don't recommend that people disinfect it and reuse it more than 3 to 4 times. So in the next slide, I totally forgot what the slide is, so I'm just going to wait for it to actually go there before I start talking. Oh, the next slide is just some different ways that our final product was, you know, distributed into the hands of community organizations that were in need. So some of those organizations were United Healthcare related senior homes and assisted living centers, La Fe community clinics, and also Del Sol Medical Center. So we worked really closely with the Chief Medical Officer of Del Sol, which is shown here, Dr. Alozi. He's a fantastic man. And he, basically contacted us. We received a donation from the Southwest Nigerian Physicians Association, and they were so generous and so supportive of all of our innovative efforts in coming up with custom prototypes and custom respirators for the hospitals. And so, through the support of the believers of innovation in our community, we were really, able to demonstrate what 3D printing and rapid prototyping can do. And on the next slide, you'll see that through our partnership with Paso del Norte Health Foundation, since they have, a lot of sister organizations that co-depend on each other across the border, we were able to donate 1,000 pieces of PPE to the Red Cross across the border in Juarez. Juarez is, hit pretty hard by COVID, and they also face the same supply shortage challenges that we do on this side of the border. So it was very important for us to be able to really treat this pandemic as it really is, which is a global thing. It doesn't know borders. It doesn't stop, at the checkpoints and go no further. It's something that affects all of us. So in addressing these issues, we really need to treat this as, a regional thing. And we were also very fortunate to have connected with an individual who was able to transport some of our PPE and the N100 material to Navajo Nations in Arizona. For those of you who don't know, Western New Mexico and Eastern Arizona has been hit very hard. The reservations have the highest per capita rate of infection in all of the United States. So we were able, we're very happy to be able to help in any way that we can, with the ongoing efforts to contain the pandemic in those regions. So now going on to the next slide. So the next slide is just, our website information. So if you want to know more about the products, if you are interested in ordering some PPE for your organization from our existing product line, or if you have a custom need for a PPE, to give you an example, we are working with dentists to custom prototype for them face shields that would allow them to fit their dental magnifying glass. I believe they're called loops, or maybe loops. I'm probably mispronouncing it, but it would allow them to be able to fit their magnifying glass underneath the face shield. So we are actively working with various individuals to address their individual needs, which I think is another strength of 3D printing and rapid prototyping, is that it's not a one-size-fit-all type of thing where you're basically forced to just live with it in those types of big box production situations. Here you can go to your local makerspace, and we can really help address custom needs, specialized needs. So you can go to our website, fablabelpaso.org/PPE, to look at some of our existing products. Now, I don't know if I've run out of time because I forgot to start my timer, even though it's in front of me. But I'm just going to talk very, very briefly about what our next step efforts are in our community. We know, I'm a parent, and as we all know as parents, that we're super worried about our children and the uncertainty that surrounds whether or not schools are going to reopen and what those parameters are going to look like for our children returning back to school. So we are also thinking about, prototyping the face shields to be child-sized. We know that children are, not as good at remembering to sneeze into their elbows, and so we really do want to mitigate the risks of what, returning back to school, even at 25% capacity, could be, for our children. And we're also placing a bid at the end of this week for EPISD to bid on face shields for their staff and workers, such as bus drivers, lunch ladies, lunch workers. And so those are some of the next steps that we are taking to address needs in our local community. And I believe that that's all I have, but I'm, very happy to answer any questions that you may have about any of what I've talked about, or just about the Fab Lab in general.
Thank you so much, Kathy. It's so inspiring to see everything that you've been able to accomplish at Fab Lab El Paso. And I know I have a lot of questions and follow-up discussion that I'm interested in getting to towards the end of the presentations. Just a reminder to those listening, you do have the option to enter questions into the dashboard questions box. And so feel free, if you have questions now, to put those in, and we'll make sure we get to them at the end of the presentations. But once again, thank you so much, Kathy. It's very definitely inspiring to see what you and what our other panelists have been doing over the last couple of months. I wanted to take just a couple of minutes to introduce Bio El Paso Juarez to those of you on the call today who aren't familiar. Bio El Paso Juarez is it launched in late 2018 as a nonprofit organization under the MCA Foundation umbrella to bring together the medical device manufacturing sector in the region, which is very robust, and had been trying to organize a cluster organization for several years. And the timing worked out to where we could bring together a lot of the different stakeholders around the medical device manufacturing industry to launch this organization. So it's relatively new organization, but has 40 members now, including some big corporate medical device manufacturers who have a big presence in the region, as well as contract manufacturers, suppliers, and others who really help to make this ecosystem run very smoothly. And since COVID hit our community, have really stepped up to respond to the needs, the PPE needs of our communities. I'm pleased to introduce Filament Labs and Mechatronics Automation in the next couple of minutes, who are both members of Bio El Paso Juarez. I think that as an organization, both the MCA and Bio El Paso Juarez recognize the really important role that research and development and innovation and creativity play in the process, the product development process. And Kathy, you really highlighted that with showcasing the products that you guys have been able to make. But especially in the last couple of months, as we've seen supply chains break down and needs increase drastically, the ability for people like Yair and Kathy and Javier to be able to mobilize very quickly and create solutions has really made a big impact and helped in the recovery process. And so at Bio El Paso Juarez, we try to bring together all of the different elements that make an ecosystem strong, and encourage any of you who are interested in learning more about Bio EPJ, as we refer to it, to go to our website to learn more. But without further ado, I'd like to introduce Yair Rios, who, as I mentioned, is a member of Bio El Paso Juarez. He is the founder and CEO of Filament Labs. He has a ton of research experience and works with a lot of the regional universities, as you can see in the slides here. He's worked at the Instituto Politécnico Nacional in Mexico City. He's worked at UTEP in their microfluidic labs, and currently oversees the biomedical engineering laboratory at UACJ. In Juarez. He has helped to organize the institutional response for COVID-19 at the university in Juarez, and is now going to tell us more about his projects and what has been keeping him, I'm sure, very busy over the last several months. So Yair, I'd like to turn it over to you. Thank you for joining us today, and just let me know when you'd like me to advance your slides, please.
Thank you, Jackie. Good morning, everyone. Well, good afternoon, right? So this is a filament, and I would like to start off with how was filament before the pandemic. We were, if you please move to the next slide, please, Jackie. Last year, we were invited to one of the, well, to some other conferences, and we were talking about how 3D printing is a key player in this fourth industrial revolution. Actually, for example, in APIX, which is a association for a society for logistics in the region, they invited us, and we were talking about how 3D printing was transforming the whole logistics of supply chains and the impact that will take this technology in the long future, right? So that was on May 20th. So we didn't have idea that this was going to happen, but what we had the idea is that this technology was empowering communities to make their own tools, to empower them to make their own solutions. And this is what filament is all about. We are trying to get these tools for the people. They can make their own solutions. And for example, as well, one of our co-founders was invited to give another talk on the Tecnológico of Monterrey here in Juarez. And as well, we were showing them how it was very hard for small startups to function, because the lack of resources and support of the community sometimes, and how you could be able to make your work or get a successful company out of all these situations. And in the same year, we had the biohack, the first edition that we prepared in the University of Juarez. We had this event where we were talking about solutions that we could make in our region for healthcare. And one of the ideas that came out then was that, hey, we could use a tool to open the door with our hands. And everybody was asking, but how come you already have those systems? But now that after the COVID-19, everybody is looking for that, right? So somehow we were prepared beforehand, like we were heading towards that, situation, and we didn't know it. So hopefully please go to the next slide, please, Jackie. When we went and talked about this with the University of Juarez, then we partnered up with them. And in this partnership, which started on March, we said, you know what, we already have experience 3D printing things. We already have some idea of the things that we might need in this pandemic. And anyways, the whole ecosystem of 3D printing grew exponentially with new ideas. Every day was coming new tools, new ways to make things, like the protective wear for mask, and the face shields, and other tools that paramedics, nurses, and doctors needed, right? So we started to working with the most common tools that were needed here. And in the next slide, we would I prepared some goals. Could you please turn to the, in this slide, we prepared the whole thing. We started printing, and we realized that if we ask everybody to come, if we ask all the makers, hey, you know what, you could 3D print this to help in the situation, we soon realized that could be potentially dangerous. I think in Spain, they stopped people trying to help, because that could make people get more mobilization, and in the end, they will get infected. So in the facilities of the UACJ and the University of Juarez, they had this facility where we could sterilize all the components in the same site where we could be printing all the things. And for example, one of our members is in the picture that I can show you. And soon after, we started donating them, right? However, we knew that it could function because previously we were working with the spirometry filters that we wanted to make them available here in Juarez, like before the pandemic. And so, and later on, when we decided, hey, how can we do something that could be workable for the people here? And okay, we already had the filters, so we just added them into these face masks that were provisional before the government made arrangements to make their own supply chains more capable, right? And at the end, has been a really nice ride. So, and the next other in the next slide, you can see other products that we were working on. And there you can see doctors needed this capsule where the patients could enter and they could intubate them, right? They use this tool to guide a tube inside of the lungs when they are not able to breathe. So we start helping them. However, in this part, we decided, okay, we have a ton of experience manufacturing. However, we don't have the people nor the tools, right? And what we decided to do is to call other small shops around the city and just give them the design so they could help us to start building those capsules for the hospitals. And as well, the idea was to make them portable so they can transport these capsules or these cabins to make them available in the rural areas of Chihuahua. So that's how we did it. Also, once we completed one, we talked to some physicians and health professionals to give us feedback about this new cabin that we, as I said, was due to the urgency that we needed to fabricate them. However, in terms of the support from the federal government to revise them, it was sort of slow. So some of them couldn't use them already because they need to be approved. However, they are designed and built, and they are on the pipeline, right? So we cannot say that we already win this battle because we don't know if it's coming another wave or what's going to happen in the next months, right? However, they are ready to go, and that's something good to know. Please go to the next slide. And other tool that we were building with this incredible team that helped us from the University of Juarez. The team that we built was composed of 2 professors, me included, and 4 students, one from the PhD program in the materials, and others from mechanical engineering and biomedical engineering. So they came out and look up for other solutions like the face shield that we donated, as you might see in the slides. And we produced last month 1,000, and we still produce them, but now for the university, because at the end the school is up as well. They are receiving students and they're preparing themselves to reopen activities. And now the whole effort is to cover the needs of the university, which population is around 20,000 in Ciudad Juarez. So it's a lot of people that needs this protective equipment, and the university is making all efforts to help them get them available. So right now, if you please go ahead and onto the next slide, please. Other basic tool was these laryngoscopes that is still waiting for approval from COFEPRIS. They are already built. We put a camera on it, and this tool, which is used for the process of intubation, it's really hard for the physicians to get them in their own clinics. So that's why we stood up. They came to us and said, hey, we need this tool. Could you help us? We said, of course we could help you. However, we don't know the whole regulation thing that has to happen before. However, we already built them. They are not being used. And we called to the local authorities to help us clear this, right? However, they have ton of work, and we understand that in the coming next or months, we expect them to help us to clear all these materials. However, we're glad, as I said again, to help with this pandemic. We had the opportunity. We sort of visualize that the future of manufacturing is within 3D printing, and people now can realize the true power and the decentralization of means of production. Now you get Cardinal Health, get all these big companies talking about taking all the machines out of China or other countries and put the eggs in different baskets. And 3D printing is a key technology to help them to do that. However, they don't trust yet in some cases this technology that it's already in the point. Maybe 2 years ago was not that feasible, but right now big companies are turning to this technology as the solution for a more distributed production across the globe. And I think that's awesome for everyone, because as well, we don't pollute with transportation, and we are very happy. Filament is very happy to help in those projects with the maquiladoras in our city. Could you please turn to the next slide, please? And finally, just wanted to mention that we made our services available. So for example, those tools that you might see very often on the media, we could help you out if you bring us a design, and or if you have a different idea that you might apply to your own door, to your own facilities. We are glad to help everyone here, and there is our contact. There is my email along with one of my co-founders' emails as well the phones that we have here in Juarez. And hope that if you have any questions or you want to add any comment, I'll be glad to hear from you. And thank everyone for your time.
Yeah, thank you so much for sharing your story and for sharing the work of Filament Labs with us. It's very inspiring to see all of the work that you've been able to do. And I know personally, when BioEPJ was meeting at the onset of COVID in our communities, and we were trying to understand what was happening and what all the different players were doing. I know that you were one of the first to raise your hands and say, you know, we're already on it and we're working on this. So I want to get back to some of the comments you had about the future of 3D printing in our Q&A. But for now, I'm going to transition over to our third and final speaker. And just a reminder again, if you have any questions, please feel free to put those into the questions box and we'll get to them at the end of the presentation. Thank you again, Yair. I'll move on now and introduce Javier Acosta, who, as I mentioned, is also a member of Bio El Paso Juarez, a very active member and an inventor, an innovator, and engineer that is well known throughout the manufacturing industry for his automated solutions. Javier, welcome, and we are very excited to hear from you about what you've been working on, applications that might not fit neatly into the 3D printed solutions, but maybe more about how you all have helped to create solutions to some of the most critical needs that we're facing today. So I know that I have to transition presenter mode to you, so everybody on the call, if you can just bear with us for 1 second as we change presenters here.
Okay. So
You should be able to share your screen.
yes, thank you, Jackie. Thank you for the opportunity to this presentation. I don't know if you hear me. Hello?
Yes, I can hear you and I can see your screen.
Okay, sure. Right now, are you seeing the first page of the presentation? Just to be sure.
Yes.
Great. Okay, thank you, Jackie. Thank you, Nancy, and thank you, Ceci Varela. Thank you, MCA, for the opportunity to share what we do in these months. I would like to start first, make some congratulations to this opportunity and to MCA for the opportunity to show how we are doing for our community. And we call this innovation during the beginning of COVID-19. So my name is Javier Acosta, and I'm the CEO of Mechatronics. And Mechatronics, for the people that didn't hear about Mechatronics, I would like to start with that. And our core technology, we are involved on intelligent automation, machine vision, robotic platforms, Industry 4.0, and artificial intelligence. So our trajectory, it's our foundation was on 2000. We start just with a dream and with a computer, with any hardware, with any investment, with anything, and just with a dream and with the passion to do something for our community through technology. And then we certify in ISO 9001, 2015. Right now, we are more than 30 engineers working here in the facilities. We work with PhDs, with people who have master degree in electronics, in computer science, and different sciences. We have installed more than 5,000 solutions around the globe, and we work a lot with artificial intelligence, and our footprint it's here in Juarez, Mexico, and in El Paso, Texas too. So we are a binational company. So we are offering services in these years for 5 countries, USA, Mexico, Brazil, Italy, and China. So we design robotic platforms, artificial intelligence, and different services for these countries. So we're seeing all this innovation and all this technology. We use a lot of artificial intelligence to collaborate with our community in these months, and I try to make this presentation very dynamic and with a flow time chart. And so we would start in March 10th. In March 10th, in the beginnings of this pandemic attack here, we start to show some help to our community and help them to how they can build their own face shields. So we try to generate videos like the video that you are right now you are seeing, and with the small things they can create a face shield with no more than $0.25, because here in Mexico we don't have a lot of resources to help. So we try to generate this kind of publicity to help our community and to use the less money, and they can make themselves. So here we show how they can make a face shield without any kind of technology, just with the hands in simple tools. In here you look to finalize how you can use a gap and how you can use your own gap and you can make a face shield. We have a lot of experience on 3D printing. Actually, we have a patent about 3D printing, but on these days, we know that it was very hard to find materials. So all the materials that we need to build something, it was very hard. So all the chain supply was broke, and it was very hard to find materials. That's why this alternative, how you can build your own face shields by yourself. So that's happened on March 10th. Then on April 3rd, we make these face shields for donations. So we make a lot of these face shields. This is our facility, this video that you are looking on the screen. And that's our team working very hard doing these face shields. And all that face shields we donate for the IMSS here in Juarez. We have a lot of necessity, and so we do a lot of donations for these face shields. We do that with our own resources. So we work for the industry, but we have some financial resources for donations. So we use it and we deliver these face shields. So that happened on April 3rd. Then, and on April 7th, we create our own first ventilator. This ventilator is invasive, and I'm going to show you this ventilator, and that was our first test, our first prototype. And I would like to be thanked to Jair Rios. He gave us a lot of sensors, and thank you, Jair, for that. And so if you look in the video, we designed all this mechanism, the interface with the computer. And so we read the pressure sensor, the flow, the temperature. We'll learn a lot from the mechanisms by the guys from the MIT and from Spain. But we designed our own system because it was much more robust than these guys. And we can control the volume, the pressure with the servo motors. So that's what's the reason of why. The reason of this is because we build machines for the medical industry. So it was very easy for us to design something like that. And so this we try to design and build this ventilator to collaborate with the community. So then we create our second generation of ventilator, and we call AI ventilator. Why the AI? Because we put some kind of soul to this ventilator. That means that we create algorithms with artificial intelligence. And let me show you this video. So we are making some tests here. It's a pressure. This we are measure centimeters of water pressure. As you look here, there's a lot of sensors, a lot of valves, and we design our own lung, simulate the lung, and then here is our software. We're with artificial intelligence reading pressure in inches of water flow and different parameters. So we can read it, and then we can predict if our patient has improved in his health or not. So our algorithm was very good. So right now this type of innovation is waiting for COFEPRIS resolution, because we have some issues there. and we need some hands. If in this room, I don't know if somebody can help doing the paper and the validation. So happy to receive you. So then in May 15, we create an application using artificial intelligence. Sorry, and these applications it helps to reopen the business on the industry. Right now, on May, all the most of the industries here in Juarez closed their doors because of the pandemic. So right now, we create a tool to all this industry to make the work safest. And that's here in the video, we're gonna show what we create. So as you see in this video, we detect the temperature of the employees before they enter to the facilities. So the operator has the capacity to read the ID, then the temperature, and our algorithm detect if he has a mask or not. So we are using vision system with artificial intelligence and face recognition mixed to detect this. If you look on the video, it detects the mask, then detect the name, temperature, and all this. It goes through a database to analyze if it has complying with all these requirements. This, for example, she didn't have the mask, so the software detect that she didn't have the mask on his face. So we create these kind of tools to reopen the business operation here on the industries. And sorry, Ken. Then we create some kind of applications for the home. Right now, we involve our team to create our home safe, and we create applications through vision system like this. Look, this guy didn't go through our sanitizer station in here, and in the red and the green square. So when appears there and sanitize everything, so it's okay. But when somebody else tried to avoid the sanitizer station, it detects and it sends it to you a message to your cell phone. So this kind of apps and this kind of technology we are doing, I don't know, maybe in these 3 months, we try to do two things: work in our machines and also create innovation and technology for our community. And also to enhance, access to learn in response to massive disruption of education due to the COVID-19 pandemic affect thousands of learners in our community. Mechatronics, our company, create an initiative to teach teenagers from 16 to 19 years old a tech camp that consists in hands-on work in different departments: mechanical, electrical, electronic, software, and administrative, where they will learn in 10 months, 4 hours from Monday to Friday, a tech training basis from the perspective of a real job. This tech camp is for free, and the teenagers will receive a salary. So these guys that you see in this picture are created this program to try to enhance access to learn. We know that right now the teenagers, it's very hard to them to have access to materials, to experts, to mentors. So we are open to collaborate with our community, teaching technology. And so this will happen in the next month. So we are right now working on this program. And this is how it works, our technology. All technology that we create, so we created to go to the cloud and to have access in your computer, in your cell phone. It doesn't matter what kind of technology. So we have access to every field of the engineering. And these are the companies that we are working. They trust us. And thank you very much.
Thank you so much, Javier. That was a great presentation, and really, really impressive, all of the work that you have been doing at Mechatronics over the last 3 months. Unbelievable, the amount of projects that you've been able to launch. Let me go ahead and see if I can get to the last slide here. And we can begin the Q&A portion of the presentation. So I know that Nancy is going to join me for this Q&A discussion. So Nancy, do you have any opening questions for any of our panelists to get the conversation started? Nancy, I think you're on mute.
Yes, I was on mute. I guess my question is for all of you, just generally, what have you found to be, or what did you find to be the most difficult aspect of getting, of responding, creating an immediate response to the overwhelming need for PPE in our region?
We could start with Kathy.
Yeah.
Okay, yeah, so I just wanted to say great presentations to Javier and Jair. It's just incredible what you guys are achieving in Juarez, and really for Juarez and El Paso too, such a boon to have both of you guys and the amazing innovative work that you guys are doing here. For the Fab Lab, I would say one of our biggest challenges is that, you know, with a lot of this PPE, they're really, you know, stopgap measures to replace or to temporarily replace medically certified equipment. And there's a lot of red tape with the FDA on, you know, where and who can produce PPE. I'll give you an example. You know, there was a need from Del Sol Medical Center. The chief medical officer, the CMO, wanted to know if we were able to 3D print swabs, nasal swabs for COVID testing. And we were able to produce viable prototypes. We got the designs from a makerspace in Spain, and we were able to produce them on our Formlabs printers. And Formlabs had launched an initiative to, you know, produce the nasal swabs as well out of their headquarters in Boston. But we, even though we had this product that was, you know, comparable to and produced on machines that are already approved to produce the swabs, we could not give these swabs to the hospitals to use. So there's some frustration, you know, and I understand that these guidelines are in place for a very important reason, and it is to ensure, you know, the safety of patients and users. But in emergency cases like these, there is definitely some level of frustration that we can't pivot, you know, fast enough because of all the rules and regulations that surrounds the distribution, the usage of this equipment. So that's been one of the facets of the challenges for us. And the other facet of the challenge is just getting buy-in from local community members. I think there's a general culture of resistance to tech in our region, where people are either suspicious of it or they are on the fence, and they, you know, they're just not as well informed about what the capabilities are of these tools and machines. So it's also, you know, trying to transform people culturally, trying to transform their mindset. That has been, you know, a simultaneous challenge as well to, you know, for us in terms of marketing and promoting all of the products that we have available.
As I think that the regulatory issue is probably one that we are going to see in Juarez also. Is that the case, Javier and Jair? And has that been a huge challenge for you all, or have there been other challenges that maybe are more prevalent?
Well, I think it's very hard here to talk with coffee please, because one day they think one thing and another day they think another. So it's very hard here work with these guys. So I think Sawyer, it's in United States, you guys has uh, more experience with all that kind of validation. In just our country, just copy these rules, and sometimes they don't have experts to doing that. In my opinion and in my experience, I worked a lot for the medical industry, and we design machines to build catheters, to build different elements for the medical industry, and all these certifications are very hard to have, and I think so we need to have a special policy for these days, because we need to go ahead with an urgent priority.
For us as well, we face the regulations situation, I would say, but as well, we have to remember that at the end of the day, we're a business. In the case of Filament, we are a startup, right? So we had very limited budget, and we were trying to get more customers, and it was a kind of a hard decision trying to visualize, hey, what do you want to do? Like, for good luck of us, I would say, we, instead of our customers came from the energy sector, so they speed up production, and as well as, so it was a hard decision. Like, do you want to split your efforts so you could meet your customers' demand, and at the end be truthful with your community? So I think that was a tough decision in that day with my team. We decided that we would split our machines, our team, in two. So was a very hard days for us. I mean, however, it totally pay off. I think it would give us the chance to meet new people, to be more efficient in our times as well. And now that we are again reorganizing, our capabilities uh, have improved, has improved, sorry, and I guess in the future you will hear more about Filament. But now, I mean, with all this learning that we've been through.
Well, then that leads into my next question. I only have one more question, Jackie, then I'll turn it over to you. How then has this need to, or this surge to provide PPE, how has it changed your long-term business model? Has it changed your business model? I mean, I think how you're saying that it, in some ways it has. So if each of you could address that.
I guess I can go first. So for us, even though we are a 501c3 nonprofit, it is critical to our operations and to the fiduciary duties of our board members that our organization remain true to our nonprofit mission. And so for us, it's a little bit of a mixed bag, because even though we are a nonprofit, we've always been very careful to have a sustainable business model and to generate revenue for operations so that we can spend our grant money on expanding the programmatic elements of our organization. That being said, I think because of this, very broad and encompassing nature of makerspace and the services and programs and opportunities that we provide to our community, the production of PPE was definitely a pivot for us, but it really does fall under our mission to democratize digital fabrication tools and capabilities and to almost be evangelists for a digital transformation in our region. So in some ways, the production of PPE was a really great way for us to demonstrate capabilities to the average person, to people who are not well versed in tech, who may not even be working in the tech industry. We're really our customers and the sector of the community that we're targeting are the laypersons. They're people who have no idea what a 3D printer is, and it's probably one of their first introductions to 3D printing. So it's changed our organization in terms of the product that we are outputting, but it hasn't changed our fundamental mission, and it in fact has, I think, helped us, make this an exemplary case.
Great.
Well, in our case, Nancy, so we do all this innovation just for our community. Our business model is build machines for the industry, and just with our own resources, we try to make donations and try to help our community. It was very hard to do this in just 3 months because we passed a lot of nights without sleep and working very hard, a lot of people, a lot of days, so with a lot of stress. And so we try to help doing what we are trying to do. And in the case of our business model, just we introduce more artificial intelligence in our products. So right now we are trying to deliver vision systems and face recognition to improve safety on the industry is what our business model changed a little bit on that.
Okay. All right.
And
Thank you.
For us, well, first of all, I forgot totally to congratulate Javier Acosta, that has been doing a wonderful job here in Mexico as well, and Kathy Chen. This is the first time that I met you, but I've heard what you've done at El Paso, and I'm pretty sure you guys are, once we can again make meetings and all that, we will totally have to get together, right? And as for our business model, I think what happened to us is that totally boosted all our activities, because now it is clear for us that all these companies are looking for new ways to minimize contact between people, and we are here to help them. And at the end of the day, Filament, our mission is to help people to bring their solutions with their own tools. So all these situations, we are ready to help. And for the business, I could say it's good for us. It's good for our business. It hasn't been has been difficult to find people, because obviously in the times that we're living, people it's afraid to get out and work, and it's very understandable, because I understand that most of the companies don't give them the proper security, right? So Filament as well, it's trying to make those changes along with all the community, and I think that's one of the things that has impacted our business, but so far so good.
Well, before Jackie jumps in with her questions, I would like to thank all 3 of you and your teams for what you've been doing. I think it's amazing how quickly everybody geared up to help, and the response that has really made a difference in our community.
Thank you.
Yes, I agree with Nancy's comments, and I just have a couple of questions for all of you. So it's good to hear about the opportunities that your work has maybe opened up, and looking forward, maybe brought some clarity or focus to the work that you've all been working at for a long time. I'm curious, you mentioned a little bit about the challenges that you faced, but I heard from each of you about some of those critical partnerships that helped you in those early stages. Kathy, you mentioned the FAB Foundation and NIH. Yair, you mentioned some of the networks that you've already been involved in. You mentioned APICS. And Javier, I know that you work a lot with the medical device manufacturers, that you have a lot of institutional knowledge and connections there. So I wanted to ask each of you, what is a key partnership or collaboration that you found the most helpful in your journey over the last 3 months as you tried to find solutions to the COVID-19 pandemic? We'll start with Kathy again.
Yeah, so you know, as a nonprofit, and again as an organization that, you know, heavily depend upon grant revenue, it was just, you know, such a important facet of our continued operation for us to have received monetary funding and support from really a wide variety of organizations. I mean, this may not be a well-known fact, but nonprofits in technology in our region, we don't see a lot of donations. We are just a nonprofit of a very different nature to, like, say, food banks or to, you know, animal shelters. I think there's an immediate recognition of what the value of those services are. And so for a tech-based nonprofit, it's a little bit of a harder sell for us to get individual donations from our community. And we really saw that shift happen with the pandemic, and with people seeing how, you know, quickly we were able to respond to the PPE supply chain shortage. I think something clicked in our community, and it was the first time in the 6 years that we've been operating in El Paso that we've seen a huge spike in individual contributions. And while it's important for us to have partners like, you know, the FAB Foundation out of MIT, and for us to be able to tap into resources like, you know, the NIH 3D Print Exchange, and to partner with large organizations on the border like Paso del Norte. While those things are important, I think the real morale booster for us, and the real motivator for me and my staff member to have worked, you know, probably like 12-hour days, 5 days a week, 6 days a week, it was the support of the community. I think that was, you know, a key partnership that is often estimated or is undervalued. It's really, you know, having that communal support, having, you know, the average member of your community seeing the value of what you do. That was, I would say, probably the most keystone part of how we were able to, you know, transform our mission and our objectives the way that we did.
Great point. And I see Javier nodding along in agreement. So do you have any comments, Javier, on the most important collaboration or partnership you've experienced?
Yeah, well, like that partnership, we don't have that kind of partnership. I remember on that days that the industry, who has more than 5,000 of people, they close their doors, and so they close the lines. They have a lot of problems. So I try to help them. Instead, they try to help me in the community. So, but I remember 3 great stories. I remember that when I tried to get Ambus to build our first ventilator, Ceci Varela from MCA, from Juarez, Bio El Paso, Juarez. She helps me with some parts that I need to build my first ventilator. Thank you, Ceci. And Jair Rios, that is right now with us. Jair helped me with the sensors because it was very hard to try to find sensors from everywhere. So that two stories are very good. And a lot of friends that help me with recommendations. Remember that there's a lot of PhDs that helps me to find out algorithms, to find out how I can change one sensor to improve them. And so we work a lot with mathematics, teachers from the UACJ, from here, from Juarez, and they help me a lot to understand different things that we don't have the knowledge to understand on that days. And I think so that partnership and also the people that work here, my team, they are very brave people that work in the worst conditions. They have afraid, they have a lot of problems, and they don't step back any day. So I'm very grateful for my team. I think so. That's my partnership that I found on these days.
Awesome. Thank you for sharing. Yeah, do you have anything that stands out from your experiences over the last several months?
Well, to start off was with UACJ, obviously, with the University of Juarez, which they give us monetary funding, right, to buy all the materials, all the, as well, we bought some printers and other types of, as well, they help us with, even with food. Sometimes they bring us everyday food for the last month. So it was kind of a really nice detail from them, right? Again, the MCA was a key player for me because it helped me to understand the whole situation in the region, because as you are working very, very good with, as well with Cecilia and you, Jackie, that you brought this information, tried to gather all the information around the players that were trying to do something. So in that direction, we planned. Where was the lack of help that maybe we could fill in, right? And the last as well, Javier Acosta, we had some exchanges of he support us with motors, because we at that time as well we're trying to build on a specific type of ventilator. And I mean, all this situation brought us together, and this is one of the positive things that we could think of.
That's great to hear, and I like that you can tell that the network between filament and mechatronics and a lot of the industry players in Ciudad Juarez is very, very strong, and hopefully, Kathy, we can bring you into that network, and everybody can work closer together across the border. You all have touched a little bit on, actually, I was about to lead into my last question, but I'd like to open it up to any audience members who might have a question. Speak now, because we'll be wrapping this up with the last question. If nobody has any, then I might just pause for a minute or two. Okay, hearing none, I will lead into my last question now. So you all have touched on some interesting comments that, at least from the MCA and BioEPJ perspective, as we try to energize the innovation ecosystem across the region and across borders. You've all talked a little bit about what the future looks like. And I wanted to start with Yair, if possible. You mentioned the future of 3D printing and how you see that growing. So can you take just a couple more minutes to talk about what that means for the future of filament and maybe what we could do to support you as a community in that new role? And then I would like to hear from Javier on what you see in terms of AI in this new COVID-19 landscape, and then maybe have Kathy give us the last word on how the community can support your future efforts. So Yair, it's all yours. Oh, I think you're on
That's a
mute.
good question. Yeah, thank you. I think during this period of time, we are experiencing, I would say, this is a life lesson for me, because we're experiencing incredible growth. And what we'd expect from the community or other people that might be one of our customers, I would try to reach them and ask them, right, just to be a little more patient, or if they have some comments, feel free to reach us, and any other things that they think that we could improve to serve them better, we will be glad to hear from them. And at the same time, we will be trying to get, we have 2 projects that we will unveil this year, and we hope to have support from you guys, just to see how what do you think about our projects, and hopefully we will see you around.
Okay, great. Javier, any last comments on the future of AI and how the community could support your efforts?
Okay, and so I think so. This next future it will change a lot in education, technology, for families, and in mechatronics we in the past we was working on digitalized machines, acquire all the data, to analyze data, and to have alarms, to have results and predict what will happen in the future. So right now we are working more in digitalize humans, digitalize emotions, engineering emotions, engineering all the functionality of the human, if he's tired, if how's the temperature, how's the oxygen, how's the everything. So we're gonna match together what the machines do and what the digitalize the humans. So together, all these data, we're gonna mix it and we're gonna make some improvements for the production and the industry. So that's we are working on that for the future, and so our doors are open. My email is javier@imechatronic.com. And if somebody on this audience would like to collaborate with us, we are open to that. We are always, our doors are open. We're very glad to receive smart people, creative people. It doesn't matter if they don't know anything about technology. The more important is that they have very good heart, very good mind, open to the different views. So, and thank you, Jackie. Thank you for having me.
Thank you, Javier. Kathy, any last thoughts on that question about community support and the future for Fab Lab?
Yeah, you know, for Fab Lab, this has been a big part of how I've been, you know, just internally strategizing for this organization. especially in light of the fact that we are part of a larger global movement. There are, as I said, thousands of Fab Labs around the world. And there's one particular initiative that has caught my attention now for a couple of years, and it's the Fab City project. It was ideated by Fab Lab Barcelona, who is really leading the global Fab Lab movement. It's really taken hold in Spain and in parts of Northern Europe. The idea behind a Fab City is that it hits upon all of the points that we've come to see realized during this pandemic. The whole tenet of a Fab City is that it has a circular economy, that it is sustainably, it grows sustainably, putting emphasis and priority on local organizations, on building up infrastructure for local manufacturing and prototyping. And, there's been over 90 cities worldwide that has declared themselves Fab cities. And that's a real hope of mine, is that in light of this pandemic, that we would be able to lobby in El Paso for our city council to declare El Paso a Fab city as well. And what that really means is that it's making a commitment to our community that growth and development is going to be rooted in equity, in sustainability, and in a way that is, going to prevent the next supply chain breakage and shortage, as opposed to returning to an unsustainable way of doing things that we saw kind of played out the way that it did with the COVID-19 pandemic. I think that for us going forward as a region, as such a unique and talented and innovative region, we do need to take back that narrative of what this border region is about and what our innovation is going to be shaped by. And for me and for the Fab Lab and our core mission, it is always about equality and equity for people who have been traditionally marginalized by the tech economies and by discourses in technology and automation, artificial intelligence, machine learning. We need to have a voice as people of color, as people living on the border, that our voice and our perspectives need to be incorporated and respected in the development of these 21st century, fourth industrial revolution technologies. So that's my hope for our region, and that's what we'll be working very hard to achieve at Fab Lab El Paso.
Wow, thank you for that closing comment. I think I can speak for the MCA team that you have a collaborator and a partner over at the MCA and BioEPJ, Kathy, and we hope to be able to work with you as you pursue that Fab City mission. I would like to thank all of you once again. I know Nancy had some closing remarks prepared, but thank you all for participating and for all the work that you do. So Nancy, do you have any closing comments?
I just wanted to echo what you said. Thank you so much for taking your time, both everyone who was listening in and our presenters. I think this is a super important topic, and I think that we should, it's one of these ways that COVID-19 has made us stronger, and stronger as a community, and I think stronger as people and the partnerships. And so thank you so much for your time. And I would say if anyone, you have the speaker's contact information, reach out to them if there's a way you can support them, whether with time, funding, equipment, materials. Don't be shy to reach out. They're all very, very approachable. And again, thank you.
Have a great rest of your evening, everybody. Thank you so much.
Thank you.
Thank you.
Bye.
Bye-bye.
Bye.